When I have a patient who I diagnose with COVID, but they're not sick enough to have to be admitted to the hospital, one of their first questions is often, "Doctor, what can I do to feel better or get better faster? Is there anything I can do?" The answer to that is yes. There are in fact some things you can do to help reduce your symptoms, and that may also reduce your risk of complications or help you heal up faster. I'm Dr. Daria, your on the front lines ER doctor, and I wanted to share with you today what I tell my patients who have this diagnosis and are otherwise generally well and don't have chronic medical conditions to help them. Of course, quick caveat, everybody is different, and I cannot see your beautiful face in front of me, so this is not personal medical advice. This is just the list that I share to my patients so that you can talk to your own doctor and see what is best for you. It's especially important if you have any medical problems, take medications or supplements, or are pregnant, so make sure to talk to your doctor. So let's get started. The first thing I tell my patients is to change their position when they're laying down or sitting. You may have heard that in the ICU, we often take patients and lay them flat on their stomach. That's because it helps aerate your lungs, get more air into your lungs. Research is still underway, but what it looks like is that kind of the worst place to lay to aerate your lungs is flat on your back. So at a minimum, I tell people to sit up in a recliner or sleep up in a recliner. Even better is to lay on your side or to lay on your stomach, but do what's comfortable for you and what helps you breathe better the most. Second thing is breathing exercises. These are things we often tell patients with asthma or COPD, but they can, again, help somebody with COVID help aerate their lungs. You can do this when you feel short of breath, or I tell my patients just to do this every 1 to 2 hours. Again, to just increase that air in your lungs. The first thing to try is pursed lip breathing. The way you do this is you're going to slowly inhale through your nose with your mouth closed. And then you're going to purse your mouth as if you're about to whistle or gently blow out a candle, and then slowly exhale. So it looks like this. That helps to aerate your lungs. Another breathing exercise is diaphragmatic breathing. Now, this can take some practice, but here's how it works. Instead of just breathing up in our chest, which we often do when we're feeling short of breath or when we're nervous or just every day, I want you to start breathing by kind of pulling down your diaphragm and pushing out your belly, okay? So put your hands on your belly. So again, it might take some practice, but it'll look like this. I don't know if you can kind of see my belly coming out. My hands are moving. You can probably see my hands moving in the video as my belly goes in and out just a little bit. Try to do those. You can either do those when you're feeling short of breath. I tell my patients just to do those every 1 to 2 hours to kind of keep the air moving. The third thing is also tied to activity. And while you do need to rest, and I don't want you doing lots of strenuous activity while you have COVID, what I do tell my patients is every 1 to 2 hours while you're awake, get up out of your bed, out of your chair, and walk around just for a few minutes. Whether that's just around your room, if you are isolating and you can't leave your room, or getting up, go to the bathroom, something along those lines, just to move, get the blood flow moving. That's going to help improve aeration to your lungs, and it improves blood flow to the rest of your body as well. Of course, number 4 is to make sure you're hydrating. When we don't feel well, we often don't drink lots of fluids. That makes us feel worse, and it's a vicious cycle. So make sure you're well hydrated. How can you know? Look at your pee. If your pee is bright yellow and feels hot when it's coming out, it means you need to drink a little more water. So make sure you're getting that hydration in there. Next, let's talk about medications and supplements you may want to take. If you're having fevers or body aches that are really bothering you, then my first line treatment for patients is to reach for acetaminophen or Tylenol. If that's not helping or not enough, then as a second line, then I have them reach for NSAIDs or medications that are anti-inflammatory like Advil, Aleve, Motrin, but those are kind of a second line. If your cough is bothering you, you can take an over-the-counter cough suppressant like dextromethorphan, or if that's not enough, ask your doctor for a prescription for a cough suppressant like Tessalon Pearls. Now, what about supplements? You've heard a lot about these. There's limited data, but that shows that they may be helpful. And again, in people who are otherwise healthy, not taking other medications or supplements, it can be recommended. I would recommend it and take these myself if I were to be symptomatic as well, and I know many other physicians who are doing them. So these are what I tell people to take for 14 days from their time of diagnosis. Vitamin C, 500 milligrams twice a day. Vitamin D, I do tell them to get their levels checked because vitamin D is one of those vitamins that you don't want to get too high. Your body can accumulate it, and too much of that's not a good thing. If you don't know your level or you're getting it checked, you can take 2,000 to 4,000 international units per day while you're waiting to do that. And then thirdly is zinc, 75 milligrams to 100 milligrams per day. Take that with food. Now again, that's what I tell them to take for 14 days. I also advise for 14 days of Pepcid, 40 milligrams daily. And then for those patients who don't have a contraindication to aspirin, so check with your doctor, I have them take aspirin, a baby aspirin, once daily for those 14 days. So there you have it. The protocol that I give my patients when they're diagnosed with COVID, aren't sick enough to need to be admitted to the hospital, and are otherwise generally healthy and not on other medications and supplements with chronic medical problems. Ask your own doctor to find out what's best for you. Please let me know what questions or comments you have. Put them in the comment section below. I always love to hear from you. And please share this with your friends or loved ones who need to have this information. I'm Dr. Daria. You know I take the very best evidence, distill it down to make your life healthier, better, and easier. Stay well, take care of yourself, and take care of each other. And I'll talk to you next time.